Anne, can I ask you to start us off with prayer
Or the Lord be with you.
and also with you?
Let us pray. Gracious God, thank you for the gift of this day and the gift of this time together. Help us be good stewards of all that you've given us, all that our parishes have entrusted to us, and open our hearts and minds to all of these new possibilities and challenges before us in terms of our healthcare. Amen.
Amen. Thank you, Anne. Just so folks know, I picked on Anne because she is a member of the Benefits Committee. Um, and I appreciate that. Okay, Joanna's asking for the PowerPoint again. Let me find that and get it in here. Okay. Okay, there you go. And now I am going to share my screen. Oh, I've lost my Zoom now. I'm sorry. There we go. Okay, can everyone see the slides? Okay, I'm getting a little bit of feedback, so I'm going to ask if folks would mute themselves. Okay, Father Michael, I got you muted. I know you're on a new computer, so I went ahead and did that. Okay, so the reason that we set up this workshop is because there have been so many changes with health insurance. This year, as hopefully you all know, the Benefits Committee had to make some really tough decisions because the changes to our health insurance premiums were so drastic this year. General Convention actually passed a resolution asking the medical trust to balance out the premiums based on how rich the plans were. So what happened was the PPO 100, which is the plan that is used by most people in the diocese right now, the premiums for 2025 are going up a little over 12.5% for 2025. So those premiums really are out of reach for most folks. Last year, we chose the PPO 100, the PPO 90 as the base plan, but asked churches to continue paying for the PPO 100 if at all possible. To my knowledge, the only folks who did not stay in the PPO 100 were folks who chose on their own to take the PPO 90 or people who were new to the diocese, new to a cure. This year, we again chose the PPO 90. However, we were not in a position to be able to say that the church should continue to pay for the PPO 100. The increases were just too much to bear. The PPO 90, the increase in the premium on that also went up 9%, whereas the other plans only went up 3%. So the suggestion this year, the PPO 90 is the base plan, and that's all we can require under our canons. Our canons don't allow for any addition to that in terms of what's required. But our recommendation is that the PPO 90 is the base plan that the church pays the premium for, but that the church should also provide each person who selects that plan with the equivalent of the deductible on that plan. On the PPO 100, there was no deductible. On the PPO 90, there is. And that deductible amount is also the amount of an increase in the maximum out-of-pocket cost. Sorry, I saw an email come in from the bishop. I just had to make sure she wasn't trying to reach me. So that is the base plan, but it's still not necessarily the base plan for the best plan for everyone. What we wanted to do is look at the consumer-directed health plan option and consider a way that might make this a better option for most folks. Now, this is not an option for people who are over age 65. Okay. If you're over age 65, you should have Medicare Part A, in which case you're not eligible to participate in the consumer-directed health plan with the health savings account. Those are Medicare rules that prevent you from doing that. But for folks under age 65, the recommendation is that this plan can be considered an equivalent to the base plan if the church contributes the maximum out-of-pocket expense to the health savings account. When people hear the term consumer directed health plan or high deductible plan, most folks panic over that. Just the notion of a high deductible is very frightening. But understanding all of the workings of this are critical to figuring out how this might actually be to your benefit. So what I wanted to do is I wanted to go over information about it, explain what the health plan is, and show some examples of how this could work. So, first of all, some basic information. The deductible, that's the amount that you have to pay before the insurance will pay anything. There is a deductible regardless of whether you choose the PPO 90 or the CDHP plan. There are some exceptions on the PPO plans where not everything is subject to the deductible. On the CDHP plans, everything is subject to a deductible. OOP max, you'll see that that terminology here. That stands for out-of-pocket maximum. And that's the maximum amount that you would have to spend on your health care throughout the year. Once you hit that maximum amount, the insurance is going to pay 100% of your expenses. A couple more key concepts are the copay and the coinsurance. These are things that folks get confused sometimes. The copay is a flat fee. It's something that you will see on the PPO plans. It's not subject to the deductible, but it is subject to the out-of-pocket maximum. So, for example, you go to see your primary care physician. The copay is $30. It's a flat fee. It's not subject to the deductible. The very first time you go to your primary in the year, it's $30 regardless. On the other hand, with the CDHP plan, you have a coinsurance, and that's a percentage of the allowable charges. It's not a percentage of the billed amount, just the allowable charge. It is subject to the deductible and to the out-of-pocket maximum. So, for example, you go to see your primary, you're going to have to meet the deductible before the insurance is going to pay anything. So you will pay the full allowable charge until you get up to that deductible. And then after that, you will pay a percentage. And I'm going to give some examples of that in a bit. Definitions so that you have this information. The CDHP, that's a consumer-directed health plan. It's commonly known as a high deductible plan. CPG calls them consumer-directed because basically these are plans that require the consumer to be more cognizant of their healthcare choices. The deductibles are not as high as what you would see in a high deductible plan out in the market or something that you might get if you were working in the corporate world. The HSA is a health savings account that is paired with the CDHP plan. It's a tax-advantaged savings that can be used for your medical expenses. Beauty of the health savings account is that that money is yours. From day one, that's your account. that money rolls over from year to year. So if you don't use it on your medical expenses this year, you can use it on your medical expenses next year. That will roll over indefinitely. And when you retire, you can use it for other things in addition to just medical expenses. One of the things about the health savings account is that you can use those funds for things that aren't covered by your health insurance as well. So, for example, if you have out-of-pocket dental expenses, there are other things that you can use those funds for that would not otherwise be covered by your insurance. So, how does the HSA work with these plans that we have? CPG will automatically set up the HSA for anyone who is enrolled in a CDHP plan. The HSA is with a company called Health Equity. HSAs generally have fees attached to them, those administrative fees, but because this is through the church pension group, those fees are waived while you're in this plan. You would receive a debit card that you would use for any covered expenses. So you're not laying out cash and then having to get reimbursed. Although you can do that, you would have a debit card that you would be able to use for any of those covered medical expenses. And again, you can be reimbursed from the account if a debit is not accepted and you needed to spend something out of pocket. So basically, your costs are capped by the contracted allowable amount, not the billed amount. That's always important with your insurance. It's something to keep in mind with any insurance plan, including your dental plan. Your in-network providers are limited to a contract that they have with the insurance company that they cannot charge over the amount that the insurance company allows for any particular service. That is very important to remember for a number of reasons, one of which is I've often heard people talking about how important it is, how much they want to be able to have the coverage for out-of-network services. If you are considering out-of-network services, please contact me. That is such a dangerous thing to do. I always steer people away from going out of network because what you don't realize is that when you go out of network, you're not limited to that allowable amount. You can also be balance billed for anything that the provider is choosing to charge. As long as you stay in network, the costs are always capped by what is contracted with the insurance company as allowed. You will pay on either plan, you will pay 100% of the costs until you reach your deductible. Again, with the PPO, that doesn't mean that you're paying 100% of services where you have a copay. You're paying that set copay. But if you're paying a coinsurance for services, which you will see on the PPO 90, for example, the PPO 90 has a 10% coinsurance for diagnostic testing. So in this case, you would pay 100% of the diagnostic testing until you reach the deductible. With the CDHP, that amount that you pay is coming out of your HSA. Again, I can't stress enough that the approval from the benefits committee requires that the church contribute the maximum out-of-pocket amount to your HSA so that you would have those funds contributed on your behalf. When does the insurance pay? Once you've reached the deductible, then the insurance begins to pay a portion. You pay the coinsurance amount, which is the percentage of the allowable charge. So on things that have a coinsurance amount on the PPO 90, you're going to pay 10% of that allowable charge. On the CDHP plan, it's 20% of the allowable charge. Again, on the CDHP, the payment is through your HSA. How high the costs can go. And I know I'm repeating myself here, and I hope you understand. These are important concepts that I want to make sure that you do understand. You continue to pay that coinsurance amount until you reach that out-of-pocket maximum. Once you reach the out-of-pocket maximum, the insurance is going to pay 100% of your covered expenses. You're not going to pay another penny for the rest of the year. Since your employer contributed that full out-of-pocket maximum to your health savings account, you've had absolutely no out-of-pocket costs for your health care. To be honest, you're going to pay less on this plan than you would on the PPO 100, which is what most of us in the diocese currently have. It's a great deal for 2025. The worst and best case scenarios. The worst case scenario, you have high medical needs, you exhaust all the funds in your health savings account, but you don't have any out-of-pocket costs for your health care. Okay. The best case scenario, you have no medical expenses and you end up having savings for the future, whether that's for future medical expenses or for your retirement. That best case scenario means you got some free money there and it was tax-free when you got it. Okay, so before I go into examples, any questions? You can also put questions in the chat, or if you raise your hand or jump in.
I have a question.
Yes, Joanna.
Oh, it's Mantel.
Oh, Mantel, I'm sorry. I
yeah.
saw Joanna's hand. Go ahead, Mantel.
So I'm looking at the chart that you gave us for health insurance premiums, that you sent out to us.
Mm-hmm.
For the CDHP for a single person, it's 14,196.
Okay.
What's the HSA contribution? Is that part of that 14,196, or is it $4,200 in addition?
I don't have the chart in front of me. Give me a minute to pull it up.
This would be in addition to that, I think.
We didn't know if the required HSA contribution. Oh, because that's what normally the cost is, and then that's the addition.
Right. It says plus. Total cost is plus HSA.
I think that's the total cost. This thing is
okay. Okay, so the 14,196, that is the total cost for the premium plus the contribution to the health savings account. The premium, the premium over there, 2 columns to the left under CDHP
9996.
Yes, 9996 is the premium, plus 4,200 contributed to the health savings account means the total cost would be 14,196.
So that's definitely less than the 1680 for the PPO 100.
Okay.
Yeah, it is.
Perfect. Okay, now I understand.
All right, terrific.
Awesome. Thank you.
You're welcome. Thank you. Joanna.
I think I just answered my own question. And thank you for opening the chart. I'm like, oh yeah, I need to look at the chart. My question was about because for me as a single parent with a kid, I was just wanting to ensure that the HSA contribution would include the contribution for the second person in my insurance. And I see that it does.
Yes.
With the 8450.
Yes, that's right. So in your case, the cost to the church would be 26,436.
Got it.
And that would include the 8450, which would be the maximum out of pocket for both of you.
Right.
Okay.
Yeah.
So absolutely.
Okay. Thank you. That helps.
You're welcome. Okay. Let me see. There's something here in the chat. How this affects family plans. Yes, Father Angelo, yes. The same goes for family plans. And I know you noted here that you have 2 children that'll be in college. And just as a reminder to everyone, our plans through CPG allow you to keep adult children on the plan until the end of the year when they turn 30. Far more generous than what is required under the Affordable Care Act. And that's regardless of whether or not they're in college. So for a family plan, the same thing holds, Father Angelo, where the contribution to the health savings account is 8,450, which is also the maximum out-of-pocket cost for a family. So again,
Okay.
the most that you would spend is that $84.50 for your entire family.
Okay. So, and again, because more than likely, at least one of them is going to be out of state. So it would be, again, sort of the diligent work of making sure that everyone, should something need to be done, it is simply in network and not out of network.
Absolutely. Absolutely. And we don't have all of the information yet. I was on a webinar with
Mhm.
CPG today, and they were telling us about an add-on to all of our plans called Quantum Health Navigator. That is, it takes the place of the health advocate and also provides other services. Everything should go through Quantum Health. And that's the best way to make sure that you are finding providers who are in network. They would be able to assist with that.
Okay.
Okay.
Thank you.
Also a reminder, regardless of what plan you're on, this includes retirees as well. Everyone is going to be getting new ID cards. Come January 1, you're going to have to use your new ID card. It's going to be a new policy number as well. Everything will be through Quantum Health. So I just wanted to mention that.
Okay.
We will be getting more information out to you in the coming weeks and the coming months. CPG is going to do a webinar for everyone on December 12th about the Health Navigator. It's a very awkward year this year. Not all of the information is coming to us as quickly as it has in the past. We all, just for those who may not have been here when we were speaking earlier, we all got an email today from CPG that told some information about annual enrollment. Annual enrollment actually opens next Wednesday. However, your annual enrollment packet hasn't actually been sent out yet. They're hoping that we'll have them by the end of next week. Annual enrollment stays open until the middle of November, so you don't have to worry about getting in quickly. You've got plenty of time. If you've done this before, if you've logged into the CPG system, you would be able to log into the CPG system next week anyway and look at your choices and process your annual enrollment if you choose to do so. But in any case, there are a number of changes that we'll be talking more about in the coming weeks and the coming months. Nothing changing specifically about the plans, but some add-ons. Okay. Any other questions? Okay. So I want to go on to some examples to give you a better sense of how this is going to work. So let me fix my view here. Okay. So I want to look at a few different scenarios. One is the person who has no health care needs. You're young, you're healthy, you get your annual physical, and that's it. Another situation could be someone with minimal health care needs. They use their health care a little bit, but not a whole lot. Then there's the situation where you have a single major healthcare event, and how might that impact you? And then catastrophic coverage. So to start off, we have someone who doesn't have any healthcare needs. All they do is their annual physical. Well, there's no cost for preventive care on any of these plans. So there would be no cost for your annual physical. So if you're on the PPO 90 and this is all you're doing is just getting your annual physical, the church is paying an awful lot of money for insurance that you don't need because you're not utilizing it and you're not reaping the benefit of it. Whereas on the CDHP plan, the church is contributing to your health savings account, so you have a savings account towards future healthcare expenses and/or retirement. So it's saving the church money and providing you additional savings. Okay, but that's the simplest case, and most of us are not in that situation. So if we look at someone who has minimal healthcare needs, so for example, you're generally healthy, but maybe you've got a minor injury or an illness during the year. Maybe you get the flu once during the year, or you have a chronic condition. that you need a, maybe 1 or 2 follow-ups and a prescription. So here's an example. This is an example if, suppose you had an episode of the flu. You go to the doctor and the doctor orders a Z-Pak. So the office bills $282 for your office visit. And the regular price for your prescription is $47.92. So according to the plan, the amount allowed for that office visit was $126.49. Okay. Now that allowed amount is going to be the same regardless of which plan you're on. This is part of their contract. So on the PPO 90, you have a copay of $30. It's not subject to the deductible, so you're going to pay $30 for that doctor visit. You also have a copay for that prescription of $10. So your total cost for that particular illness was $40. Okay, so that comes out of your pocket because you have not yet met your deductible. You pay that full amount. Okay. Out of pocket on the CDHP, the amount allowed by the plan is $126.49. You haven't met your deductible. You have to pay that full amount. The same thing with the prescription, the $47.92. You haven't met your deductible. You have to pay the full amount. So this episode costs you $174.41 for that bout of the flu. Okay. All of that came out of your pocket. However, with that CDHP, the amount was paid by your employer who contributed that money to your health savings account. Cost you more, but it came out of money that was given to you rather than out of your own pocket. Someone who has minimal chronic needs, that same scenario would continue. You would continue paying the copay on the PPO 90. You would continue paying 100% of the allowable charges until you reach the deductible on the CDHP plan. Once you reach the deductible, you would then pay 20% coinsurance. On both plans, you would continue to do that until you reach the out-of-pocket maximum. Out-of-pocket cost on the PPO 90 could go up to $2,500 out of your pocket. Out-of-pocket cost on the CDHP could go up to $4,200, but that comes out of what your employer contributed to your HSA. Now, the example that I'm giving, I'm using single coverage, and I'm using that because I have those figures, okay? The same thing would apply with family coverage, except that the amounts would be different. Okay, so a single injury, a surgery, or a hospitalization. So on my example, I'm looking at an outpatient surgery to insert a plate following a wrist fracture. In case anybody needs a hint, this is my personal experience. So the surgery center, and this page is just for the surgery center. I'm going to go on to the surgeon on the next page. So the surgery center billed $46,818. The plan only allows $9,537 only. On the PPO 90, you have a $500 deductible. So off the top, you pay the first $500. On top of that, you pay 10%. So you would pay an additional $903. So that brings you up to a total of $1,403 paid out of your pocket for that wrist surgery. On the CDHP plan, you've got $3,300 deductible. That comes out of your HSA. And then you're going to pay 20% over and above that deductible. But you have an out-of-pocket maximum of $4,200. So it's capped right there. So you pay that $4,200 out of your health savings account and you're done. The insurance pays the rest. Now, in addition to the surgery center, you've also got a bill from the surgeon. So the surgeon is billing $88.30. The insurance company is allowing $51.69 for that. On the PPO 90, you still have to pay 10%, so you're paying another $517. But on the CDHP, you've already hit your out-of-pocket maximum, so the insurance company is paying the entire thing. You're not paying another penny. So that surgery cost you $1,921 on the PPO 90 out of your pocket. Then there are additional costs for medications, specialists, therapy, follow-up diagnoses, diagnostics. All of that is going to come out of your pocket until you hit that $2,500 maximum, which will happen pretty quickly on this. Now, $500 out of that out-of-pocket maximum, we're hoping was a taxable benefit from your employer. Since it's taxable, you don't get the full benefit of the $500. So more than $2,000 came out of your pocket for that one wrist surgery. So here's the CDHP. The surgery cost you $4,200. You don't have any additional costs for any medications, no specialist visits, therapy. You've already reached your out-of-pocket maximum. The entire $4,200 was a non-taxable benefit from your employer because they contributed it to your HSA. There was $0 out of your pocket. You spent every penny that your employer gave you, but you didn't spend a penny out of your pocket. And you don't have any additional costs for your health care through the rest of the year. So a catastrophic situation would go beyond that. Catastrophic could mean as simple as just a second event, a second injury, a second surgery, a second hospitalization. But once your out-of-pocket maximum was reached on that first event, the insurance continues to pay 100%. This is not per event. This is per year. So you're already done, and you don't accrue any additional debt for additional medical needs. So what else do you need to know about the two different plans? Okay, same networks, Anthem and Cigna. There's no difference there. The allowable charges are the same. They're under the same contract. All plans will be under the Quantum Health Navigator, so you would have that benefit regardless of which plan you choose. All plans include prescriptions, but the costs are going to be different. They're defined by each plan. So on the CDHP, you're going to have different costs for your prescriptions than the co-pays that you have standard on a PPO plan. All plans include IMED, vision care, and all plans include the Employee Assistance Program. So, got questions? You got problems? I think I've talked to most of you about health insurance before, and I see Mantel's hand raised. I'm going to stop sharing my screen. Oops.
You hear my choir singing. So when we go to call our doctor's offices to see if they're covered under this new CDHP plan, what do we tell them? Like, what is it Anthem? Is it Cigna? Is it?
If your providers are covered under your current plan, they're covered under the CDHP. It's exactly the same. You choose whether you want Anthem or Cigna. So if you're on Anthem now, you want to keep your providers, you keep Anthem. If you're in Cigna now, you want to keep your providers, you keep Cigna. If you're in one of them and you're having issues with finding providers that are in the network, or you're having any kind of issues, you can switch which carrier. The coverage is the same regardless of which carrier you have, and the coverage is the same. I mean, not the amounts, but the network is the same regardless of whether it is the PPO or the CDHP. These are national networks with both carriers.
Awesome. Thank you.
Mm-hmm.
Oops.
Other questions, comments, thoughts? Joanna?
I just want to say thank you. Like, I'm like, okay, now, because it's very clear to me. Because I heard it when we had the clergy thing and it was the brief, kind of thing, but seeing the numbers and hearing you speak, I'm like, okay, now I got it. I'm moving towards the CDHP because I have a kid with a lot of doctors. So just to know that contribution is there for the HSA is like, that is key. That is key for me. So I am grateful to all who made that happen.
Thank you, Joanna. And we are going to be working over the next year, working on our canon, because up until now we've been somewhat trapped by that. We need to figure out the best way to do this. Our canon right now says that if someone chooses the CDHP and the church chooses to contribute to the HSA, then they have to do the same for any employee who chooses that plan. There was no requirement that an HSA contribution be made, and we were not able to require it based on the way the canon is written. What we did this year, we tried to think outside the box. So we looked at it as trying to make it comparable and saying, okay, we are required by canon to choose a PPO plan as the base plan. And in part, it's also because not everyone is eligible to enroll in a PPO plan. To enroll in a CDHP plan, I'm not eligible to. I'm disappointed. I would love to enroll in that plan this year. But what we did was we said, okay, so as an equivalent, we have this way of looking at the costs so that we can save money for the church. It's going to cost the church less, and it's going to provide a benefit to the individuals that, as I said, it can roll over to the next year. It can roll over to retirement. Now, here's another thing, because a couple of you have mentioned talking about having those high costs, those high medical costs. We don't know what the choices are going to be in 2026. We're looking at 2025. We do know that the PPO 100 and the PPO 90, we expect them to still be available in 2026 based on the call I had today with CPG, but the plans will be less rich. So the benefits will not be as high in those plans come 2026. Whatever happens, we don't know what may happen in terms of the CDHP and the required contribution to the HSA. We certainly will not take it away. There will be a required contribution, but we don't know how high it will be depending on many other factors. Folks who do not need to use those funds, they will roll over. You will have those funds for future medical expenses and or retirement. If you exhaust those funds and you feel in 2026 that the amount being contributed is not going to be sufficient for you to want to choose that plan, you can change plans. Okay, you can change plans each year at annual enrollment. So that is an option for you. Sarah.
I have a question regarding funding of the plan. How does that work? Like with the HSA, will it all be available like in the beginning of the year? Because usually you're billed monthly for the plan.
Right.
And so if you have an event that's in February, is that whole 4,200 really going to be available in February?
And this is something that we cannot dictate. However, this is definitely a negotiating point. Okay, churches, and of course, Sarah, with the diocese, that
I know it's different for the diocese.
Yeah, right.
But I know that that's probably a lot of question because people are thinking that maybe it's going to be, but normally it's a monthly
Right.
bill that you're getting that they're contributing to each month. And so will it be available at the beginning of the year? And so I think that would be a question for a lot of congregations as well. That's why I'm asking.
Absolutely, absolutely. And that's an important thing for all of you to discuss with your lay leaders, how to do that, because that can also depend on circumstances. It can be something where potentially someone may choose this plan and say, okay, based on my situation and based on the church's situation, they can contribute it monthly, the same way as they're paying the premium. On the other hand, it's also a negotiating tool for all of you to say, you know what? I'm saving the church money. I need you to do this. If you have particularly if you have a specific need early in the year, or you may say, you know what? Instead of doing it monthly, let's do it quarterly, or let's do it every 6 months. Whatever is going to work best for you and your congregations. We also don't want to dictate. We have congregations that, this may be a problem to contribute all of it at once, and you don't need it. We don't need to micromanage that. That is something that you can certainly negotiate. And anytime you run into an issue with any of this, if you feel it needs to be done a certain way and you're running into an issue with your lay leadership, contact me, contact the bishop. We will get involved. All right, Mantel, we're watching you on camera, I don't know what was going on there, but
I was just telling him I have an issue with my lay leadership.
But it's something that the point is, it's something that you can work out. We don't need to micromanage it unless you need our assistance in that.
Are these suggestions something that have been written or going to be presented to, say, the treasurers of parishes, or something that we can hand off to them, or sort of, again, we kind of take the time to try and explain it and then call you if we can't get it quite right?
The requirement to contribute that full amount has been written. It was in the piece that was in Good News in the Garden State last week. That is the official word. If there is anything that is needed in terms of how to make it work, then you want to be in touch with us.
Okay.
Okay. Thank you.
Yeah, no. I just kind of,
Mhm.
not that I expect a lot of pushback from my treasurer, but
Sure.
yeah, y'all didn't hear me say that, but yeah, I mean, I just want to kind of know if I should need some extra information, where to find it.
Absolutely. Absolutely. You can always contact me. You can always contact the bishop. If I can't solve it for you, I can contact the bishop. We will find a way to work it out. And the information is also posted on the human resources page of our website. And I know our website is not very user friendly, but if you go to our website under what you need, human resources, everything is on that page. There are also links to the premiums and links to a comparison of the plans. So that information is all there available for folks as well. Any other questions, comments, concerns? You're an easy crowd.
But Pat, one of the things we were joking about was that the health savings account belongs to the insured, like it belongs to the clergy.
Yes.
Okay.
Yes.
But
Mhm.
So
what I said is, what if I run her over in the parking lot in March? You know, just to get to take her with her or whatever. But
Or what happens if I go to a bigger parish,
yeah,
make more money, then I could take that $4,200 and then I could have the next parish pay $4,200. And then I could switch again and I could roll that 8,000 over and I could just keep changing parishes for like the next 10 years and I'd have enough money to buy a house.
there you
Well,
go.
there you
Now,
go.
there's a thought. There's a thought.
You've just explained
Yeah.
this beautifully. I thank you
Yes,
so much because
thank
I did not understand any of this and thought I should just go with the PPO 100 because that's what I know. And this is hugely helpful. I can't even tell you this is huge.
I'm so glad it's helpful, Mantel. Really.
Thank you.
Oh, we lost somebody. Well, I don't have anything else that I need to share. If there's anything that you need, you know how to find me. I think most of you know that the easiest way to reach me is by email. Even if you want to chat, send me an email because I may not have my phone handy and I can get back to you right away. But I get my email right away. Okay. Let me see if there's anything here. And thank you, everyone. And if that's it, go and enjoy your evening. Okay.
Thank you so much, Pat. This is, yeah, like Mantel was saying, just super helpful.
I'm so glad. I'm so
Yeah.
glad.
Yeah. Yeah.
And like I say, if you have questions about it, you've got the PowerPoint. I can send it to you if you'd like. If you've got questions about it, or if your lay leadership have questions, you can always direct them to me as well.
Thank you.
Okay. Thank you, everyone. Okay, so have a wonderful evening, and I'll look forward to seeing all of you sometime soon.
Yep. Thank you, Pat.
Thanks. Bye-bye.
Thank you. Good night.
Good night, Sarah. Thank you.